My name's Declan Costello, and my first degree was in music at St John's College, Cambridge, where I was a choral scholar. And when I finished my music degree, I studied medicine at Imperial College in London, and I then trained as a specialist in ear, nose and throat surgery. And within ear, nose and throat surgery, I now specialise in voice disorders. So I spend much of my time seeing singers and performers who have problems with their voices and trying to help them to unravel things. A lot of the performers I see are singers of a variety of different backgrounds, but I do see some actors and occasionally dancers and other performing professionals as well. These people are performing vocal athletes. They need their voices to be in absolutely top shape, and for that reason they need to be vocally fit. And at the first sign of any problems with their voices, these people will often want to seek some medical attention. So yes, these people are very high-level performing athletes. The majority of the time, problems with voices aren't actually related to pathology, related to lumps or bumps on the vocal cords at all. More often than not, it's related to how the person is using their voice in terms of muscular tension or excessive voice usage over periods of time. So a lot of the time, the conversations I'm having with singers are about vocal technique and making sure that they're seeing their singing teacher regularly, their vocal coach regularly. Vocal cord nodules, for example, which singers are absolutely paranoid about developing, often come about as a result of long-term overuse and abuse of the voice. You're bashing the vocal cords together very hard and you develop thickenings, calluses on the vocal cords. On the other hand, if you develop a sudden injury, an athlete, a running athlete might pull a muscle, well, a singer would be more likely actually to bring the vocal cords together with a bit too much energy on one occasion and pop up a vocal cord polyp, which is a single swelling that comes up very suddenly, usually over a matter of a few seconds during a performance. So again, as with athletes, you've got this difference between long-term injuries and long-term problems, and then on the other hand, an acute injury, a sudden injury. So there are a number of conditions that in the general population are very common, but actually most people aren't using their voices to the very high level that professional singers are. But actually, if you're a singer, those very subtle problems can cause issues. And reflux is a classic example of that. Reflux in the population is pretty common and very rarely cause significant vocal problems. But for performers, if you've got even a modest degree of reflux, that can irritate the vocal cords, it can cause them to be a little bit inflamed, and that will mean that you're having difficulty getting the vocal cords together and you might have difficulty with certain parts of your singing range. So yes, getting on top of particularly things like reflux and throat clearing and other things like this are really important, particularly for singers. I think it's always important to seek medical help when you think there might be a fundamental underlying significant concern. I don't necessarily think that singers should come to the doctor at the first sign that there's a problem with their voice. I think actually the first port of call should probably be their singing teacher or voice coach, just to see if there are any technical things they can iron out. But actually, if the technique is working okay and if the voice is still not working well, then I think it is important that people seek a medical opinion. The longer a person leaves their voice and they're not really sure of what's going on, the longer physical attributes creep in, like muscular tension and actually psychological stress creeps in as well about what might be wrong. And if you leave it 6 months, 12 months, 18 months before you seek some help, then you might have ended up with a whole lot of entrenched muscular tension problems that wouldn't have happened if actually you'd looked at this in the first instance, dealt with it and moved on. A red flag symptom for a performer would be something like persistent hoarseness. If your voice is husky most of the time and never gets better, that's possibly a sign that you need to come and see somebody. If it's varying, if it's okay one day and not so good the other day, then that implies that there isn't necessarily a lump or a bump on the vocal cord, but it might be to do with how you're using the muscles. But for me, I think persistent hoarseness over a period of time, maybe 2 or 3 weeks, that should probably trigger being seen by an ENT surgeon. The treatment that a singer will undergo depends very much on what we see when we have a look at the larynx and what the voice sounds like. Sometimes it's as simple as saying to them, actually you need to go back to your singing teacher to have some further coaching to optimise your technique. Other times the patient will need to go and see a speech and language therapist because actually the speaking voice is more of a problem than the singing voice. Other times they might need medication if there's reflux or if there's irritation of the larynx. Occasionally, a singer will need to have an operation on their vocal cords. That's not normally the outcome, and if we do suggest surgery for a singer, then often it will go hand in hand with vocal therapy at the same time as well. Singers are very worried about coming to an ENT surgeon for a number of different reasons. Firstly, there's the process of having your vocal cords examined, which involves putting a tube in the nose to have a look down. And then there's a concern about what the surgeon might find, and is this going to be a career-ending injury? Actually, in truth, it is very rare that a vocal injury is career-ending. And then I think more broadly, there's the concern about singers that if they have a problem with their voice that requires some treatment, somehow by their peers and by people in positions of authority, they're seen as being vulnerable or maybe not somebody that they would want to hire in future. So there's a worry about sort of reputational damage, if you like. So vocal injury and coming to see an ENT surgeon historically has been a bit of a taboo subject. But actually more recently, a lot more singers and performers are talking about it in the same way that athletes do. You know, sportsmen have their joints operated on all the time, and it's not a taboo subject in there, and it really shouldn't be for singers either. There are lots of different things that performers need to do to keep themselves healthy. There is a raft of different measures that we refer to as vocal hygiene. So looking after your voice, that involves things like drinking plenty of water, avoiding caffeine, avoiding excessive alcohol, treating other medical conditions like reflux if you have reflux. So the vocal hygiene aspects of things are really important. I think looking after your instrument, your vocal instrument, as the central tool of what you do is critical, and for that having regular singing lessons and voice coaching is really important. Touching base with a singing teacher regularly, because even for the best singers in the world, they sometimes slip into bad habits, and having a regular session with a voice coach you trust, who can look from the outside with another pair of eyes and ears just to finesse your technique, is extremely important.